Good afternoon and welcome to the Dairy Signal. We're glad you could join us on this Thursday afternoon. Today we're pleased to be joined by Dr. Ryan Breyer, Clinical Assistant Professor of Large Animal Internal Medicine at the University of Wisconsin-Madison School of Veterinary Medicine and Diagnostic Case and Outreach Coordinator at the Wisconsin Veterinary Diagnostic Laboratory. Dr. Breyer will be discussing how vaccinations and treatments, when done right, protect calf health and performance, but when done improperly can add necessary stress and long-term setbacks. This session will help dairy teams sharpen their techniques and reinforce protocols that support healthier, less stressed calves. Dr. Ryan, I will turn it over to you and let you introduce yourself a little bit and we'll get started.
Sounds great. Thanks, Amber. As Amber said, I have a split appointment both at the Wisconsin Veterinary Diagnostic Lab and the School of Veterinary Medicine, where I am a clinician on the clinical floor, but teach in didactic and laboratory teaching as well. This topic that we'll be discussing today, vaccines and best practices for medication administration, is something that we do on a daily basis and make sure that our new developing veterinarians have a good understanding so that when they get out into practice, they too can be those educators and help in any protocols out on the farm as well. So these are things that they know, and I'm happy to be here today and sharing this knowledge with you as well. And a lot of this information may be a review for you, which is great, but then I hope you can take a few bits of information from this and apply it to your operations as well. So without further ado, we'll get going here. So a little bit of an outline of how I like to go through things, like Amber said, definitely going to talk about the best way to handle instruments and equipment, approved personal protective equipment or PPE, and then safe handling and disposal of sharps and needles, and then proper administration and restraint of animals, and then the directed techniques for administration of these medications. And then at the end, kind of start from the backwards that was described here. We'll go over a few vaccination programs as far as a review and how that can be implemented, or at least better knowledge on farm as well. So appropriate PPE for injections or personal protective equipment. Hand protection is really a necessary component part of medication administration. We like to see it being utilized as much as possible. Not only is it protecting you as the caretaker provider for these animals, both young calves and older animals, but it can also help those animals as well. So you're not transmitting bacteria or any pathogens from one animal to the next. So utilization of disposable or rubber gloves to protect your hands during these procedures is the best way to practice good hygiene when handling medications. Face and eye protection, strongly recommended, not required. There are certain medications that are typically prescribed by veterinarians, or they have to be administered by or oversight of the veterinarian or by them themselves. Then we typically recommend eye safety and face safety because they can be dangerous if consumed or injected themselves. So, and part of that mucous membrane, like the eyes or the mouth, can certainly be a way of entry for splashback kind of from those medications. So eye safety is helpful. You only have one pair of eyes or two eyes, so it's good to keep them protected when handling these animals. Face shield, again, that's a little bit above and beyond, but if there is a reason why, and a lot of times it's maybe organic material. I think I have an image of me here in a few slides where it would have been helpful for a face shield when I was processing animals. So again, something that's not required, but definitely recommended if you think about it or have the opportunity to. And these next two are kind of a given. When working with animals, we want to have good foot protection and body protection. So want to wear closed-toed shoes or some kind of footwear that will help protect your feet. Now, I say that here generally in the United States, it's kind of something that we take for granted. But when I go to other countries, you'd be surprised at how many people are in very little protected feet protection or shoes. Sometimes I'm working with people that are in sandals or in barefoot. So that's another way to transmit diseases through you. You can have micro abrasions or lesions on your feet, and parasites or bacteria can certainly infect those abrasions. So it's always good to make sure that you're wearing comfortable, supportive footwear when working with cattle, because there's dangers too of them stepping on you as well. Body protection, most of the people that I work with on farms typically have designated clothing or coveralls, and that this is really helpful. And sometimes they change their coveralls from one area of the operation to the next, such as the calving area to the milking parlor, because you are working with a different group of cattle and their pathogens and their ability for immune defense is different. So if you're showing up in the calving area with dirty coveralls from the milking parlor, that might not be the best way to show up in those environments, because these calves certainly may not have exposure to the pathogens that may be on your coveralls. So keep that in mind. Again, recommended, not required, but it's always good to arrive as clean as possible into those different areas, especially when you have animals of different populations of ages you're dealing with. All right, and safety first, proper animal restraint. And that comes in a wide variety of forms. So it's beyond just personal protective equipment. Proper animal restraint is most critical to reduce that risk of injury to both human and animal you're working with. And it all depends on the size and the temperament of the animal. So in this case, we have some calves that are just pre-weaned, and this was a gait that we can utilize to maybe process these calves or vaccinate these calves so that we can restrain them better than just on a regular rope halter where they're trying to alligator roll or twist and turn out of your restraint. Something like this is easily made on farm and easily moved from one area to the next, as well as easily cleaned and disinfected after use too. Keep that in mind. Cleaning is really helpful, and something that you can have a chain down here in this area by the nose of the calf and chain it to another gate or to a wall, and then you can push that animal there to dehorn them, give them their vaccines, castrate, what have you. Another image I have here is your neck restraint by a head catch, whether that's a portable head catch or by something that's more stationary, like a stanchion. This is also helpful, or a headlock at a feeding bunk. This is very helpful to provide neck injections because that's a wide, or an area that we utilize quite heavily for cattle, is our what we call cervical region or neck region for injections. Here's the image that I was talking about before, is where I wish I had a face shield, but luckily I have prescription eyewear, so I'm always wearing glasses. I could wear contacts, but I find that it's really helpful to have your eyes protected. And you can see that if I didn't have my glasses, I would have definitely had some of this blood spray into my eyes. I was doing a surgical procedure here. It wasn't a sterile procedure, but a procedure. I think we were castrating calves or potentially dehorning calves, and we had a bleeder that got a little bit out of control. But that would have been a place in the stage where face shield would have been helpful. So we'll go to safe needle handling. So it helps you as a medication administrator, sorry, to provide this medication with ease when you properly restrain the animals. But you also want to make sure that you're handling these needles and syringes appropriately too. So we'll go through different approaches, but just so you're aware that the approach or the plane and how you basically inject medication into an animal will help minimize any risk or any lack of administration. So a lot of times I see some people, they don't know how to approach a sub-Q injection, and they try to tent the skin, and then they inject through the skin through and through. So the medication actually goes through the needle and out the other side of the animal because the needle is poking through the skin. So it's important how you handle using a one-handed technique or two-handed. I typically like to use one-handed techniques because two-handed, you're more at risk of stabbing yourself. So one-handed technique, being assured of your placement and what angle you need to approach it by is really important. And then product knowledge. What are you administering? Is it a vaccine? Is it a thick, more viscous Exceed antibiotic or Axinel antibiotic or any of the antibiotics that have a little bit higher viscosity? Nuflor is also a very thick kind of medication. So it's really important to understand what kind of viscosity your medication you're injecting, and that you might need a larger diameter needle, or what we call gauged needle. The smaller the gauge, so a 16 gauge compared to a 12 gauge, 12 gauge is going to have a larger diameter to the needle, where the 16 gauge or the 20 gauge is going to be a smaller diameter, harder to push some of those thicker medications through. So it's important to understand that product knowledge. And sometimes you learn that by drawing up that medication. And if you're finding that it's really hard to draw up, or if you have a lot of resistance drawing up that medication with a certain size, diameter, or gauged needle, you can always switch it before you inject it into the animal so that it is less painful or less difficult for you to inject that animal. Now, the last thing, you have to be mindful of the size of the animal, because injections do cause a bit of initial pain. So you have to be cognizant about that. You don't want to use a huge bore needle on a small 5-day-old calf. On an adult cow, yeah, that we would use that more often, but keep in mind the size of the animal that you're injecting as well. There's a great website here from the University of, Virginia Tech cattle restraint document that is good to kind of peruse of the different restraint models out there. So needle safety, I see this all too commonly on the farm. This not only scares me because I'm worried about someone potentially pulling that needle out, and then they jerk it out, and then they come back and stab their lip or their face. But also, we're on the farm, and it's not that clean of a place. And I know I come from a farming background, and I've done this, especially when I was younger and more naive. But when putting something in your mouth on the farm, you eliminate any safety against pathogens that might be in and around the environment that you're working with. So for needle safety, not only from an infectious standpoint, but from a physical poking yourself with a needle, don't do this. So again, needle safety, I think it's important to kind of go over this. Do be prepared, know what size of needle and syringe you will need, what medications you're going to need, so that you don't have an animal restraint for an unneeded amount of time. Make sure that you draw up substances close to the preparation area as possible, so you're not running back and forth, and wearing your PPE. Restraining, using restraint devices helps with animal control, and then use appropriate sharp containers. And I'll talk about that here shortly. The don'ts: don't drop multiple needles and store them in your pocket. There are some different medications that can be affected by the different types of plastics that are used if they have that contact, or even sometimes when blood is drawn, you have to make sure that's evacuated into a blood storage container as well. So don't draw up things unnecessarily in far advance. Do not carry needles or syringes capped or uncapped in your pocket. Use a container. It's easier to kind of go through that motion of quickly putting something in your pocket, and then you find needles in the wash machine or dryer, which then is a risk for the people that are laundering those clothes as well. Do not put hands or fingers in the path of the needle. Again, when people tent the skin to do a sub-Q injection, I kind of refrain from that and use the single-handed technique where I control the syringe and then inject it underneath the skin. And then do not rush. Be direct and understand your endpoint of injection and know what needs to be done. And if you have to practice on that, with that, or watch people or observe them, that's another way of kind of preparing yourself too. And don't throw sharps in trash. Throw them in a designated holder. So here's something that we teach from a recapping a needle standpoint: the one-handed scoop. This way you don't have to worry about potentially stabbing yourself or injecting yourself with something that had been already used or has a medication in it already. So using the one-handed scoop technique is a way to recap these syringes. And then there's also needle cap holding devices. Now, you don't have to necessarily buy one of these devices. When I've gone out to farm where they're doing synchronization protocols, they'll have the cart, and on a cart with medications and syringes, they'll have a 2x4 with some holes drilled into it. And once they uncap a needle, they'll put the needle cap in that hole of the 2x4, and then when they need to recap that needle, then they can just push it through that hole that's drilled through the 2x4 that's stationed or secured to the cart, and they can then dispose of that needle appropriately. So again, to reduce inappropriate needle sticks to the people that are handling those syringes. So a real quick, easy, inexpensive way of creating your own recapping device for needles. Disposal of medical sharps. Now, the next slide has some information on ordering containers, but you can certainly use your own container as long as you make sure that these sharps that are going into it, and when I say sharps, that means needles or scalpel blades, what have you. It should be a container that is closable at the end of use. So once it's full, that it closes and seals, is puncture resistant, it doesn't leak, and it's appropriately labeled that this is a sharps container. These red sharps containers are available for purchase at a very low cost, and they come from as small as a soda can to as large as a 15-gallon barrel. So that's really helpful to have on the farm. And once these are filled, then you can take them to a sharps disposal site. And to find that, I have this QR code as well as the website at the DNR. They provide information on medical sharps to go to, and then you can find, it actually gives you a map. It'll show the state of Wisconsin, and you put in your address, and it'll show you the nearest area that will take medical sharps for you. Sometimes there is a cost for disposal, and a lot of times there is not. So the package of needles and sharps can be safely disposed of so that they can be handled as medical waste, not just get thrown into a landfill, where that again promotes or provides an unsafe disposal area for them. Again, the don'ts for sharps: don't put needles and sharps in the trash. Don't put needles or sharps in recycling containers. Again, it presents a issue for people that work in recycle centers to have to worry about being cut or stabbed by those medical sharps. And don't flush needles or other lancets or sharps down the drain. Here's a few other websites that I find important for registered location for disposal of medical waste. So if you're finished with any medications that need to be disposed of because either they're expired or out of date, contaminated and no longer useful, there's a medication drop location. The DEA has a drop location for medical waste as well. And then needle disposal location finder. Again, that's the DNR website that I said before in the last slide that you can utilize to drop off at nearest places. And sometimes those places, again, they have to be a designated site. Not all pharmacies might have a designation for sharps and disposable waste, but there are a few pharmacies on that. So I think here in Madison, there are some pharmacies in town that will take needles for disposal reasons for medical waste. Sometimes hospitals do this as well. Or the one place that doesn't accept medical disposal resources is the UW Hospital, veterinary hospital. So we actually take our medical waste to a different center for disposal. So keep that in mind. Do not drop your medical waste and sharps off at the vet school. All right. Proper administration of medication. So this is where I was going to talk to you about the angle and the holding of your needle and syringe. I find this diagram really helpful to understand how to hold that needle. And I really like to outline or kind of highlight, and I'll see if I can get a laser pointer here. Yeah, this needle holding area right here, where the degree of injection is 90 degrees. We want to make sure that we would get down into the muscle layer here. So you can actually be quite direct in your approach at 90 degrees to make sure that you have good deep tissue or muscle injection. And we also want to make sure we have a long enough needle. So an inch long needle for a calf of 5 days to 3 weeks would probably be fine as an inch, but that inch may not get into a deep muscular bed for an adult cow. So 1.5 inches or 2 inches may be more appropriate. Subcutaneous, now you can see that the direction or grip of a subcutaneous injection is a little bit different. These are all one-handed techniques that I'm pointing out here. So you secure the syringe a little bit closer to the hub of the needle. The hub is where the needle attaches to the syringe, and you can grasp that needle a little bit better, kind of like using a fork to scoop up something, and you're using that in the same kind of motion as you are with a subcutaneous injection. Intravenous, again, you're going to change that angle more or less at a 25-degree angle to go into a vein to give IV medications such as Banamine. I won't really discuss intradermal. This is something that we typically use for blocking during surgical techniques. So something that a veterinarian would utilize, and that definitely is a different grip. And one thing I will mention about intradermal, if you're sub-Q, and you're finding it really difficult to push medication through a syringe, you're probably in that in the epidermis or an intradermal type of injection. You're not sub-Q. You're not deep enough and then also you'll feel a really hard, it almost feels like a BB or a little marble in the skin, and it is movable. That is likely an intradermal injection. I mean, you'll still kind of feel that in subcutaneous injections, but it's a little bit more squishy wet after, and it disperses over time. Those intradermal injections will stay there for a longer part of time because they don't have great vascular access to pull or draw the medications away from that site. So you want to really kind of avoid the intradermal injections when giving antibiotics, anti-inflammatories, or vaccines. All right, drug administration, just some shorthand for everyone. Intravenous drug administration directly into the bloodstream is IV, sub-Q, SQ, that's under the skin, intramuscular into the muscle, intranasal. Now we have some vaccines that go intranasal for better mucosal detection of the vaccine and pickup of the vaccine and recognition of vaccine components. And then oral or by mouth, that's usually denoted medically as PO or per os. That means by mouth. If we want to stop giving something like feeding or water, typically we say NPO, so nothing by mouth. I really like this injection techniques document here to the right. It is from the Beef Cattle Research Council in Nebraska. Sorry, I think it's from a few different places. So can't say that strictly from, I think it might be some other beef producing agencies that went in together. But this is a really good document for determining what type of needle you're going to use, whether or not you need to do a subcutaneous or intramuscular injection and what those look like, and then what size of needle, depending on the weight of your calf or cow that you're utilizing these injections for. So I'll go through these one by one quickly. IM or intramuscular injections. Typically, you find a place of intended injection in the safe zone. So this area right here, what we call cervical, because it's the cervical spinal cord, which is the neck spinal cord region that we want to worry about, not worry about, but avoid making contact with. So actually from the skull of the animal, the vertebra kind of dip here and then come back up to the shoulder. And then this area right here is what we call the nuchal ligament. It's strong connective tissue attaching the top of the head a little bit lower back to the spine. And then we want to avoid the shoulder here. And then this area right here is the jugular groove. And if we're not intending to give an intravenous or IV medication, we want to avoid that jugular groove. So the red areas are areas to avoid. This picture gets better. I know it's a little bit blurry right now. It gets better in the next slide. But the safe zone, especially for intramuscular, is highlighted here in green. And then we can also give injections in that blue area, and it's a little bit further caudal or to the back end of the animal, and this is indicated by the blue color. So sub-Q, we can go a little bit further back, and sometimes we need that because animals need multiple injections. A lot of times I like to switch if an animal is getting a medication on a daily basis, I like to switch from one side to the next side for those medications. Try not to utilize intramuscular injections in the hindquarter of animals because it can be quite painful. There's the sciatic nerve that runs back there, and then it's an area of waste in the food department for people. So as far as food chain goes, we don't want to see, there's a lot of reaction to muscle tissue, and a lot of times that gets trimmed away. So meat quality assurance, we try to avoid those areas. So insert the needle to the hub, attach the syringe and aspirate, meaning pull back to make sure you don't have any blood and you're not in a vein when you intend to be IM or sub-Q, and check for negative pressure. So negative pressure means that if you pull the plunger on the syringe, it should automatically or pull back to that neutral state of where the medication is. And then if we're introducing or injecting a large volume, maybe 30 cc's or 30 mils of a antibiotic or of an antibiotic intramuscularly. Typically, we don't like to use more than 10 to 15 mils per injection site. And a lot of times you can move that needle. So if my hand is the plane of the skin and this is the injection plane, sometimes you don't have to move that needle all the way out of the skin. You can pull back on the needle and then redirect, and then pull back on the needle and then redirect again. These are all considered different injection sites. You don't want to just stick and then move that needle around because basically you're making hamburger. You have to retract your needle and then push back into another site so that it can be equally distributed by that injection. All right. Sub-Q injections. Now, this is an example of the tenting technique where I see a lot of people will tent the skin, and a lot of times, especially in animals with a lot of hair during this time of year, we may not know that our needle goes in the one area of the skin and out the other. That's one reason why I don't like to use a two-handed technique. The other reason is because I'm a lot more likely to inject or stab myself if I don't have good control of the animal. The other thing here too to understand is once you get under the skin, you can actually move that needle side to side just a little bit, and it's not going to stick or try to rebound back. When you're in the muscle, it's going to be a little bit harder to move that needle side to side. When you're sub-Q, you should be able to almost feel that needle under the skin. I would not do that because you could potentially stick your hand again. But sometimes if you're practicing, you can kind of feel that needle underneath the skin. Again, you'd aspirate or pull back on that syringe to make sure that there's negative pressure or no blood. And then two, we don't like to inject more than 10 to 15 mils per injection. The only caveat I have or exception I have for this injection site would be if you're providing some sub-Q fluids for a calf. So if you're providing LRS, lactated ringers, for a calf and are doing that sub-Q, you can put a bit more of that fluid because it's easily taken up by the body quickly, and it's an electrolyte solution. All right, here's that diagram a little bit closer up. Again, that nuchal ligament is a really tough, dense, soft tissue. So if we inject into that nuchal ligament, the medications are not going to go anywhere. Again, we want to practice that safe zone of injection in this neck region, avoiding the spinal column that kind of comes down, swoops down, and then comes back up at the point of the shoulder. And then the shoulder, of course, we want to avoid that because there's a lot of vasculature, especially down here near the armpit region. And then we have the spine of the scapula or shoulder blade that we have to be mindful of hitting, and that can be quite painful too if you hit bone. That periosteum or area of bone, peri meaning around, and then osteum, bone, is really sensitive and can be quite painful if we hit it with a needle. All right. This image right here just showing blood draws. We can do a blood draw from the jugular furrow or the jugular vein. And then if you're collecting a small amount of blood on adult animals, typically don't do this on calves or young stock, we use the middle coccygeal vein or artery, and it runs beneath the vertebra here. You can see the vertebra and then where that blood vessel runs. We did have this opportunity to practice this type of blood draw at Calf Care Connection back in October, and I will be at the business conference for PEPW, hopefully with a few more tail models to practice on if you plan on attending. And then one more slide about needle safety and choosing the appropriate needle size. Here are the different approaches: intravenous, intramuscular and sub-Q, and then what type of needle size you would potentially choose when utilizing these types of injections. So this would more or less be a 12 gauge needle for an adult animal and maybe a 20 gauge for a calf. Inch and a half is typically enough. And sometimes for those big monster bulls or large dairy cows, you may need a 2-inch needle. Depends on the age and the size of the cow or the bull. I am in the neck for calves, again, typically don't like to go larger than 18 gauge unless you have a really thick substance and the calf is a little bit greater than 500 pounds. Adults, 18 gauge to 16 gauge would suffice. And we can go on as a shorter needle with a calf because their sub-Q and skin layer is much shorter, it's a lot less deep. And then the sub-Q, typically a half an inch or an inch needle, around that 18 gauge is adequate for these animals as well. So I will kind of turn gears a little bit and kind of say the administration of medications is important, but also understanding what you're administering. And we'll go through a few vaccines for review, but just want to check in with Amber. Are there any questions?
Yeah, actually, I have a question for you, Dr. Ryan.
Yep.
So walking through what you just talked about, what happens if a shot is administered wrong? So like, for example, I administer it sub-Q, but I think I hit the muscle. Does that, what could happen if that was a potential outcome?
Yeah, great question. Again, it's all dependent on what you're administering. A lot of times it may not be the end of the world. Just know that. So if some vaccines get injected IM, most vaccines are labeled sub-Q. That's why I'm saying this. But if you have a vaccine that is administered IM, it's not the end of the world. That animal will probably be a little bit more sore. It might have a reaction because the body is able to pick up that vaccine and potentially utilize it much faster. They might have an anaphylactic reaction, but these are very low chances of occurrence. So keep that in mind. There are injections that if you don't inject them by label, such as Flunix and Meglumine, commonly referred to as Banamine, but that's a trade name. So it's not all just Banamine. It can certainly be your non-steroidal and anti-inflammatories, which are that Flunix and Meglumine. But if you inject that IM, it's very tissue reactive, and it usually sets up an anaerobic environment for bacteria to invade a little bit more easily, such as Clostridium. And we call this a myositis. So myo meaning muscle and situs meaning inflammation. And then that would attract those kind of bacteria there to cause infections, such as blackleg. So we see a lot of blackleg occur from improper needle cleanliness because it might be injected into the deep muscle of an animal, and maybe it is Flunix and Meglumine, and it is very tissue reactive. Clostridium is everywhere in the environment, and it sets up shop, and it just multiplies and goes like crazy. The kind of the therapeutic response that we have with that is actually doing what we call a fasciotomy, and that's basically cutting into the skin of the animal to provide oxygen to that area, because Clostridium is a bacteria that grows without oxygen, and it grows rapidly without oxygen. But when oxygen is exposed to that area, then it will reduce its growth with oxygen present. Now, am I saying anyone that feels the need to give those kind of medications IM should not worry about it because anytime something happens, they should cut the skin of the animal? Absolutely not. you should treat the animal as on label. Banamine should be given IV, or flunixin should be given IV if it's an injectable, or if it's Poron, great. Poron is another great means if you're not good at administering that medication IV. So, but the last thing I want to promote is giving that medication IM, because it can be deadly. That bacteria can grow, it can overgrow, and then it can cause tissue death and then release of toxins, which will then lead to death in those animals. Great question. Hopefully I answered that appropriately and gave a good example.
Okay. You did. Yes. Thank you very much. Ready to learn more about vaccine review.
Great. So vaccine review, again, like to go through goals of vaccination programs. They should provide optimal immunity to the herd. So we want to use vaccines that animals are going to utilize because they're going to be exposed to the pathogens that those vaccines protect against, such as respiratory disease or GI disease, what have you, or diseases that interfere with reproduction. We want to protect the animals, protection for the animals most at risk. So typically our calves are growing animals that have an immune system that is still developing are going to be most at risk, or cows that are just coming through partition at the end of their gestation and then they calve. Their immune system usually dampens, and they're more susceptible or at risk to infections. We want to make sure our vaccination programs protect animals during the period of maximum challenge. So respiratory disease, maybe this time is the best time that we see respiratory challenge. So making sure that these animals are prepared well in advance to these swings in temperature or really harsh environments such as heat stress or winter colds that really draw calories away from the animal's growth and are used to just keeping them warm. Because when calories that were intended for growth is not only size, but growth is for maintenance of the immune system or growing of the immune system, as well as production. So whether that be milk production or reproduction of a calf. So those environments, heat stress and cold stress, are times of most risk. Defense against the agents or diseases that they're likely to encounter. So if you are not utilizing or not using live cover for breeding, such as a breeding bull, your need to protect cows against vibriosis or Campylobacter infections or trichomonas is typically low. So we wouldn't have to vaccinate against those diseases. Typically, if you're not needing to, or you have good rodent control, we're not needing to vaccinate all our cattle with rabies. Now, sometimes there are state-by-state regulations. So rabies is a vaccine that is required, or brucellosis. Say that out west, when there's a wildlife reservoir like bison, buffalo, elk, or other wild cervids, their risk of brucellosis is higher than maybe here in the Midwest in Wisconsin, where it is not a recommended vaccination if you have a closed herd. So those are all things to consider. Don't need to vaccinate unless these diseases are something that there's higher concern that these animals will encounter. I don't want to say that you shouldn't vaccinate for brucellosis or your Bangs vaccinations, because it's always a great vaccination to have, especially if cattle are moving from one area of the country to the other, especially when calves are grown off-site in a different state. Very protective vaccine. Cost effectiveness. Again, that's another good driver. It shouldn't be the only driver of your vaccine programs, but it should be cost effective. So you have to weigh the cost versus the risk and how much protection it's going to provide those animals. And then last but not least, we don't want to provide any harm. We don't want to create or give these animals vaccines that are actually going to harm them or be detrimental to their health. So it's easy to prevent, it's difficult to prevent infection, but it's easier to prevent disease. So what I mean by that is we can certainly get infected with a bacteria or a virus, but if our immune system is primed and ready because of vaccines, then the parent disease will be less and the animal will be able to take care of that itself because its immune system is well established. And I'm going to show these two pictures of some necropsy tissue provided by some of my colleagues here at the diagnostic lab. So this image on the left, so pretend that this animal, actually both of these animals, their head is pointing towards this way or to the right, and their back end is pointed towards the left. And then the lung here, this is normal lung, is right here. And then you can see a little window of the heart here, and then the back of the lung here with the diaphragm right behind it. And this is the abdominal cavity. This is what lung should look like. This is a healthy, this is an animal that was not brought to the diagnostic lab for respiratory disease. This was an animal that was brought for another reason. But you can see that this is a pristine lung for this animal. This animal, the only kind of area of normal-ish type lung is what I'm outlining here above the most dorsal portion near the spine of this animal. Everything from here on down is all abnormal lung. So here, this area is hemorrhagic. This area of yellowness is fibrin, so proteinaceous material that's kind of coming from the vascular system to help protect the lung. And then we're seeing areas of microabscessation all throughout here. And then this is just area of collapse, hemorrhage from this animal as well. So very much abnormal lung. This animal probably right here was vaccinated and may have had a bout of or a challenge from a respiratory bacteria or virus, but was able to get through it because it was well protected. This animal, likely not. I can't say that this animal was not given a vaccine, but maybe it was multifactorial. Maybe it didn't get the right vaccine. Maybe the vaccine wasn't appropriately stored. It's really important to make sure your vaccines are stored appropriately, especially killed and modified live vaccines. They need to be refrigerated until use, and making sure that your refrigerator works. So yeah, there are refrigerator thermometers that are quite inexpensive. So just making sure that someone can write down the temperature of the refrigerator outside on a piece of paper of the refrigerator to say, yep, we know that the refrigerator was normal at this time, at this day, and then all of a sudden, oh shoot, the thermometer says a warm refrigerator. Are these vaccines not going to be efficacious? Should we alert the veterinarian, or should we get some more vaccines because our fridge isn't working? It's really important to monitor that. So having a refrigerator thermometer is really helpful.
Hey, Dr. Ryan, since you mentioned, always checking on the temperature for your fridge for vaccinations, kind of made me think of when vaccinating. I mean, how long do you have if you're outside vaccinating a bunch of calves, especially in these cold days, before, your vaccine becomes unviable? Or, is there anything in that regard?
Great question, and you're getting ahead of me, Amber.
Okay.
So I'm gonna talk about that when we talk about the different types of vaccines. So in the next couple slides, we'll talk about that. But I will say that's typically not the severe cold that we have to worry about vaccines being affected, but more of heat, and then the timing of when we mix those modified live vaccines, how quickly we have to use them. So to get going, because I know we're getting close to the top of the hour here, program parameters other than vaccines that we have to keep in mind to make sure that we're setting these animals up for the best possible best possible immunity is colostrum management and calf feeding programs. So depending on what plane of nutrition that these animals are and that they're getting a good a transfer of passive immunity is really important. Replacement heifers. I kind of touched on this a little bit before. Are these heifers being raised on farm or are they raised off site at a heifer grower? And if they are they mingled with other animals from other sites? That's all important information to know. And that might trigger, well, if they were grown and raised here in Wisconsin, we might not have to worry about this disease or another disease. But maybe we have to find out a little bit more information from our heifer grower of where some other animals are raised and make sure that they're not bringing something into the herd that might affect my animals that I've shipped off to a heifer grower. So having that information and vaccinating appropriately is important before they leave the home farm. Housing and ventilation, individual, especially when we're talking about calves, individual versus group housing. This is important because group housing, yes, they can certainly share those germs. A lot of times it makes a hardier calf, but a lot of times these animals are exposed to pathogens that can certainly put them down or at least make them sick a lot faster. So making sure that they're protected with vaccines for those shared germs, just like going to preschool or to the daycare, and managing an environment for changes in seasons. That's really important too. So changing your curtains so that these animals can conserve their energy and calories and not push those calories into keeping themselves warm. They can use them to maintain their systems, especially immune system, reproductive system, and then just regular growth. Cleaning and disinfection. This is a big component, especially for my colleague, Dr. Sockett. He's kind of the cleaning guru here at the WVDL. At cleaning and sanitation, whether you have to do a few audits here and there on farm, and just making sure that it's clean, because the more organic material, such as manure or dirty environments, the higher likelihood that these animals will be exposed to those pathogens and more challenged that they will be up against. Like I said, high plane of nutrition, that goes for both calves and cows, and then low stress handling. If we don't create a bunch of stress, especially when cows are going back and forth from the free stalls to the parlor, or just in general handling, if that can be low stress, then their immune system is not being drawn from as well. Stress can put a lot of undue harm on cattle. And then remember not to forget your vaccine program goals, which again is promoting optimal immunity, protecting against the diseases of greatest concern, and then understanding the times of maximum challenge. So here is where your question comes in, Amber. So different types of vaccines that we use commonly in cattle. Modified live. Typically, these are two components where you have a liquid and a dried pelleted form, and then you constitute them to create a vaccine. And then the reason they're called modified live vaccine is because they contain a living, what we call a attenuated or changed bacteria or viral organism. So they go through a process that is called attenuation, where they change the pathogen so that it's not completely that pathogen, but at least incites the immune system response to create an active cell-mediated immunity. And that's what I have right here. So these vaccines produce a stronger, longer-lasting immune response through active immunity. A lot different than passive immunity that calves pick up from colostrum consumption. This vaccine can be given the natural route via the natural route of infection, which is if it's a respiratory vaccine, you can give it as an intranasal, and that mucosa of the mucosal tissue of the nose will pick up that vaccine and create an immune response. And a lot of times they're a lot stronger than the subcutaneous injections that we typically give. And we call that the parenteral route. That's this word right here. So parenteral route is usually injection under the skin. And although these are attenuated, there is still a chance that the virus can potentially replicate in the body and cause disease. So it's really important to give these vaccines away from stressed animals or animals in reproductively fragile times. So that's why a lot of the modified vaccine companies recommend that these animals get a modified live vaccine. The pre-breeding animals get their modified live vaccines before breeding, at least a couple times before a modified live gets given while they are in gestation. So there is greater risk in stressed or immunocompromised animals there. This particular vaccine is more time dependent. So once you reconstitute it, it should be utilized typically within 2 to 4 hours. But I would recommend reading the vaccine label to ensure what kind of time length you have on those modified lives. Typically, after these have been reconstituted, and it's after that 2 to 4 hours, the efficacy of those vaccines starts to trail off. And for most of them, again, I can't speak, I'm just speaking generally, not for everything, but typically those vaccines are non-efficacious at 24 hours. So you want to use them up relatively quickly. That's why I recommend not reconstituting a 50 cc vial and only vaccinating when that vial can vaccinate, or maybe 100 cc vial can vaccinate 50 cows, and you're only going to vaccinate 4. Probably not a wise decision. I would go for maybe a smaller multi-dose vial. Then we have the inactivated or killed vaccines. It's, again, the pathogen is grown and then chemically or physically killed. This cannot cause disease. These vaccines cannot cause disease, unlike the modified live. They stimulate the immune system to produce antibodies. So again, a little bit different. We call that the humoral response. So we have passive immunity, active immunity, and a humoral immunity. Humoral immunity is creating those antibodies. So just a different type of the immune system that's being activated here. Adjuvant is a part of the vaccine that is added to increase the immune response. It's not the vaccine or the part of the vaccine that's going to cause immunity, but it does have a little bit increased risk for reactions such as anaphylaxis. So keep that in mind. These vaccines can be stored in refrigerated temperatures and can last a long time. So they have a longer shelf life a lot of times. They have a number associated with them, and they call that the seal puncture rate. So if they're punctured too often or after so much time after opening or that first puncture, then they should be discarded after that. And then again, they can be refrigerated, but again, read that label. And then a lot of times these vaccines, their duration of immunity is a little bit less than the modified live vaccines. Again, I'm speaking generally, not specifically for all killed vaccines. So they may require some boosters. And then there's these 2 types of vaccines I wanted to just quickly touch upon. The toxoid vaccines, these are typically vaccines that protects against toxins produced by the pathogen, but not the pathogen itself. So there are some vaccines, typically Clostridial vaccines that are a lot of times toxin producing. So the Clostridial vaccines will create an immune response to the toxin. And once those toxins are recognized in a natural infection, then the immune system can respond appropriately. Now, this is not the same thing as an antitoxin. Antitoxin is a treatment or therapy. It's not actually a vaccine. So a toxoid is a vaccine because it will stimulate the immune system. And then autogenous vaccines are vaccines that do not fall under the USDA guidelines for regulated vaccines. So these vaccines are typically derived from bacterial cultures or isolates that are submitted by the farm of origin to create the vaccine for that farm. In Wisconsin, I know these vaccines can only be farm specific. So what that means is they can only be used on the farm that the isolate or bacteria came from, and it can't be sold to others. Now, there are different regulations from state to state, so I can only really say that they can only be used on farm here in Wisconsin. Typically, they're not tested for their efficacy or safety, so that's unknown. So their protection against a certain disease is unknown. And you have to consider when federal license vaccines are unavailable for a specific farm, whether or not they are going to be helpful or not. And then if this is something that you're considering for your farm, you definitely should keep your herd veterinarian in the conversation with to get some more information to see if it's cost effective and if it's going to be helpful on your operation. So here I just wanted to kind of briefly show you how the immune system kind of fluctuates over a lifetime. So if this is where a calf is born, here's conception, and then here's innate immunity. This would be in the adult animal, of course, over on here. And then the calf's life starts here. We have passive immunity from colostrum, and over a short amount of time, that starts to wane. And then we have weaning here, but the calf then is exposed to pathogens within the environment, and it starts to build up. And that's what we call the active immunity, and we have humoral immunity here as well. So, or innate immunity, that's another form of immunity too. So active immunity, both cell-mediated and humoral, and then that innate immunity, what you're kind of born with and develop. And then that window of susceptibility, it's just kind of taking this area of the graph and showing it here. This is the area that calves are most susceptible to disease. So utilizing those different areas, like I said a few slides ago, where we have to make sure that these animals are in good plane of nutrition, their environment is clean, and we don't have significant stressors such as heat or cold stresses, is really important during this window of life because they're more susceptible to disease and infections. Just a reminder of that area of good injection sites. And then I think this is one of my last slides here. Vaccine words to live by. Vaccinate on label. I'm here to recommend you read your labels because it's really important. Vaccines are not typically based on weight. They're typically based on dose. So it's a 2 cc or 2 mil injection or a single mil for a calf. Administer via the route that is on there. So typically we don't want to give parenteral or things that get injected under the skin up the nose. And then you want to store and dispose of appropriately. And these instructions are on the label as well, or you can look them up online. Sometimes those little inserts are really difficult to read, so you just have to go label instructions of that medication in there. They can be blown up on a computer screen. When administering boosters, like I was talking about in killed vaccines, typically you want to wait at least 2 weeks minimum for a booster, and a lot of times up to 4 weeks. But again, every vaccine is different, so make sure to read that label. And then some thoughtful considerations. Vaccination in the face of an outbreak is really not advisable, because these animals are already stressed, their immune systems are already heightened, so they want to kind of combat things. So their ability to kind of process a vaccination is going to be limited. So if you're going to vaccinate in the face of an infection or an outbreak of an infection, know that the response to that vaccine is going to be dampened or reduced. Immune response requires good nutrition, management, and a healthy animal. If you don't need a vaccine, don't use it. Again, these are things you should discuss with your veterinarian and do this on an annual basis because things change from year to year. And with that, I'll take any more of those questions, and I'll also say it was a pleasure to speak on this topic today.
Well, thank you, Dr. Ryan. We really, really appreciate that. And I learned a lot and took a lot away from today's episode. One question for you before we end today is, so you did cover a lot of information. What are a couple key messages you really want our listeners to take home with them?
Yeah, what I'll say is practice good needle handling. I know it can be really easy to take a needle cap off and put it back on with your hands, or take it off with your mouth. Try not to do that. It's a poor habit to get into, and if you have developed that habit, really try to not do that. And then when it comes to vaccines, even with the vaccines that you're used to utilizing, it might be good just to read back up on them, see if things change, because things do change over time, and talk to your veterinarian about these different vaccine protocols and how they might change. How might you change your vaccine program to be better utilized by the animals receiving those vaccines?
Perfect. Awesome. Well, I'd like to thank you once again for being with us today and sharing your expertise. And if you'd like the opportunity to dive deeper into what Dr. Ryan covered today, he will be at the PDPW Business Conference that is happening this March 4th through the 5th at the Alliant Energy Center in Madison, Wisconsin. So we hope to see you there. We wish you a wonderful weekend and look forward to seeing you next week on the Dairy Signal.